involved in patients' lives on a daily basis, getting to know them and their families, very rewarding. Hi, I'm Andrew. I'm a GP in Yate and Chipping Sodbury, where I've worked now for the last 17 years. I'm seeing people through the difficulties they face on quite critical points in their lives. So being able to support people and help them through that, I think is a real privilege. As well as being involved directly in patient care, I'm also a GP trainer, so I'm also involved in training new GPs. Have these young enthusiastic doctors coming through and and try and impart to them some of the knowledge and skills I've gained over the years, but also I learn things from them too. About a year ago I also took up the role as a board member on our local primary care trust here in South Gloucestershire, and that's been a real eye-opener for me, seeing the complexity and difficulties of managing the NHS on a sort of a much bigger level rather than just in our practice. I think one of the great challenges of general practice is that we have to deal with a person's physical, psychological and quite often emotional needs in a 10-minute consultation. It's where my faith does make a difference. Even when I'm under pressure, I try and remember that each patient is a person who's made in God's image, and therefore that helps me try and concentrate on the needs that they have rather than on my own agendas. At times we do see problems that flummox us and we're not quite sure what's going on, and sometimes taking the opportunity to say a quick prayer, I'm sure God can use those moments to just help us get to the nub of what's going on in a particular consultation. As regards points for prayer, I think specifically for primary care, that's GPs and community nurses, in recent years more care has moved out of hospitals, and in primary care we're managing increasingly complex patients, but we've had very little increase in resource to help us manage that. So with an ageing population and increasing financial pressures that we're seeing within the NHS, it's becoming increasingly challenging to do all that we need to do here in the community. We're on the brink of a very major change. That most of the services currently provided at Frenchay Hospital will be moving to Southmead Hospital early next summer, and that's going to result in quite a significant reduction in the number of acute hospital beds we have. This isn't necessarily a bad thing. It'll be a powerful driver to review how patient care is provided, and I hope it will result in far more, particularly rehabilitation, taking place closer to the patient's home. There's a lot of planning going on at the moment on how we're going to achieve this, and I think we really need to pray for all those involved in the implementation.